So let's do our injury update, powered by the Sports Institute at TSAOG Orthopaedics and Spine, online at TSAOG.com. Let's welcome on the Buyers Barricades guest line, Dr. Harrison Scofield. Doc, appreciate you taking the time. Obviously, by now, everybody in San Antonio are experts on blood clots now that Victor Wembanyama has one. But one of the questions that I keep hearing is, why is he out for the season if they're able to isolate it, put him on medicine, and hopefully get that thing to dissolve?
Yeah, guys, thanks for having me on. That's a great question. And, very rare. We've seen this a couple other times with Chris Bosh and other players. But the concern, when the blood clot is just in the arm or the leg, which actually the leg being much more common than the arm, that really just causes some mild symptoms like swelling and pain. The concern is if that blood clot were to break off and go to the lungs, that's a potentially life-threatening condition. So that's going to take some time for the medicine to work to fully break off that blood clot. And if he were to be, active in obviously professional level sports, an additional injury or something else could potentially cause that blood clot to break away and go to the lungs, and could be a very serious and even potentially life-threatening situation. So that's the concern. And certainly unfortunate that the Spurs were putting together a really nice season, hoping to kind of sneak into the play-in conversation at least. But certainly unfortunate end of the season for Victor.
Yeah, no doubt about that. Now, Doc, when you're talking about this and you make sure that the medicine's working and the clot is going away, how often do you typically check something like that?
Really, typically in a standard patient, you would just kind of monitor for symptoms, and usually you wouldn't do any repeat imaging unless there's any change in symptoms, as the medication should be working. Obviously, it's a little bit different scenario, so I'm sure the team at UT Health is doing a good job, and they'll likely be monitoring a little bit more closely with repeat scans and just ensuring all this is heading in the right direction. So, and it sounds like in his case, it's a situation where he can just take oral medications and the blood will just resolve on its own. If that doesn't work for any reason, or if the clot gets larger, you can go and either mechanically remove the clot or apply basically very high dose medication right to the site to immediately remove it. But that can be a risky situation as well, so you like to try to just do the medications when possible.
Doc, when you think about the Spurs and where they are now, I would just say, with Vic out, playoffs, forget. De'Aaron Fox needs some off-season hand surgery. Better to do that now as opposed to waiting until May or June just to make sure he is fully ready to go for next season?
Yeah, it sounds to me like it's going to be a situation where even in the off season that he would probably be able to go as soon as the season's over. But I agree with you. It's kind of, the reality. It's probably kind of tank mode for the Spurs, and we might as well kind of go ahead and try to lose a few more games and maybe bump up our draft grade a little bit.
I like the way you
think. I don't think it's a crazy idea, and that way he can get more time to recover in the off season. But certainly it's also nice to get him some game reps here, kind of getting into our system as well. So certainly a trade-off, but it's certainly a good thought.
Well, with the loss of Wemby, Doc, you've got a shortage of big men for the Spurs, and now Charles Bassey's going to miss tonight's game. He was out with a right MCL sprain. Now his left knee, he's got a bone bruise. A bone bruise, is that basically what, a bruise? Like you just banged your knee a little too hard and it's sore?
Yeah, that's essentially what it is. And, it's something that even if you can get an MRI, you can see it. And it can be incredibly painful. The bone is actually very sensitive and has a lot of nerve endings. So bone bruises can be very painful, and they can be really variable in recovery, usually just be in a few weeks. But sometimes these can be stubborn and take some time to get better and go away.
Dr. Harrison Scofield joining us here on the Blitz. Finally, while the Super Bowl is in the rearview mirror, you're hearing about some injuries that happened during the game. One of them is surprising to me. Nolan Smith suffered and then played through a torn triceps during the Super Bowl. One, how's that happen? How do you play through an injury like that?
Yeah, I read that story. I was shocked. That's really, really pretty incredible, because it's something that usually you would feel a pop and notice pretty immediately, and there'd be basically a defect where the triceps is and is in the back of your elbow and allows you to extend your elbow. And so normally you'd feel a pop, notice immediately, and usually have fairly significant weakness with trying to extend your arm, which obviously you can imagine that's going to be something that's highly needed. So I'm not exactly sure at what point it happened during the game, but certainly speaks to his toughness as a player that he was able to play through that. Now, I'd be shocked if he didn't know that something was significantly wrong when that happened and just decided to play through it, which is certainly impressive.
Just one of those, it's the Super Bowl. I ain't coming out of here unless there's a stretcher and you strap me to it.
That's the one game you got to play through. Yeah.
Absolutely. Dr. Harrison Scofield, always appreciate the knowledge and insight. We'll talk again soon.
Thanks so much for having me on, guys. Appreciate it.
That's our injury update powered by the Sports Institute at TSAOG Orthopaedics and Spine, online at TSAOG.com.